So, like Lauren said, we'll be chatting about, are we addicted to the aesthetic? So today, this panel will explore how culture, marketing, and social norms have shaped perceptions of nicotine use within our communities. With our featured speakers, first, Dr. Kendrick Dartis, Vice President of Outreach and Engagement Initiative at Truth Initiative Nation's largest nonprofit dedicated to nicotine-free lives. Next, we have Dr. Eddie Hackler, cardiologist and health advocate. Look, they look good, don't they? Next, we have Dr. Chris T. Purnell, Director, Center of Health Equity at the NAACP. All right, let's get seated and get into this conversation. All right, we're going to get straight into it. First, we all know that hookah and nicotine is all the rage, especially where I'm from in Atlanta. You can't go and get breakfast without getting a hookah. So now I want to know, how has hookah and vaping became normalized within the social and cultural spaces today?
Yeah, so the tobacco industry for years has created opportunities to really create engaging ways to engage Black audiences and Black communities by socializing. We know that we are social people, and I know that the tobacco industry has created waves of getting hookah into our communities through club settings and as well as things vaping in our communities, because people know that we drove down the rates of cigarette usage, and so they had to find a different tactic and a different way to get our people hooked.
Wow.
And just to add something to that, in particular with our youth, it is a very social element. So it has been normalized. I mean, I sit on a school board. I'm not only a physician, but I sit on a school board.
Wow.
And we talk about not just hookah and vaping, but how smoking has almost become so like cool, trendy. And the kids are thinking, oh, this is how I de-stress.
Right.
Yeah.
This is how I just live.
Do you feel like time kind of repeats itself? Because, like, my father, he actually passed away from lung cancer. But what I found out was, he was like, when I was 13, that's what everybody was doing. And so he was like, I was peer pressured into that. And then it came a time where people weren't smoking. But now you feel like it's coming around, but with it, like new innovative ways, like hookah, right?
Yes.
All right. So the role of marketing, influencers, and social media in shaping the perceptions of hookah and vaping, like you just spoke on, how do you feel like that has affected it?
Because social media is so accessible, right?
Yes.
And living in today's world, and I talk about this with my nieces. I call my nieces my boo-bots. And living in today's world, what you see on social media is almost like a reflection of who you should be, a reflection of who you could be. And so what we see is we see things that we know aren't helpful, things that are harmful, being presented in ways that, oh, it's okay, oh, it's cool, oh, it's ordinary, oh, it's really not that important. I have students that I talk to, and they're looking at me like, Doc, this is good. It's all right. It's not as dangerous as you think it is.
And I think to add on to that, really, if you mask it in, cherry limeade flavors,
exactly.
The flavor aspects really create a sense of, people thinking that it's okay.
Yes.
And so we know that the tobacco industry has created these flavors to really marketing to youth and audiences because it makes it more palatable.
So what do you feel like many people misunderstand about nicotine addiction?
So one thing that people misunderstand is that nicotine is such a dependent thing, and when you smoke, it actually binds to receptors in the brain, and that releases dopamine in the body, and it creates a reward sensation. Exactly, and it happens quickly, less than 30 seconds. So nicotine through smoking is like one of the fastest ways that people get addicted to smoking.
So do you feel like nicotine and social media are kind of the same things, like how people are addicted to social media? Do you feel like there's some synergy there with the same thing?
Yeah, no, exactly. So people want that quick reward. Yeah, exactly. So
they can get it with social media and they can get it with nicotine. Yeah, absolutely. Okay, guys, sorry, my little iPad just went off on me. Okay, so with the health impacts of hookah and vaping, how do you feel like we need to be able to change that moving forward?
We need to be able to help people understand the dangers because right now, if you're having conversations with people about hookah, they're like, oh, I'm not
not
doing
that
it
bad. Yeah.
as often as maybe somebody who smokes. But what we know is that those who use hookah, because they're doing it in a setting where they get more prolonged exposure, is actually more harmful. Okay. So if you think about it, it's 100 to 200 times the amount of smoke that you would inhale if you were using cigarettes. And then also, what people don't talk about with hookah, there is a infection risk, right? You're sharing mouthpieces, you're sharing tubing, you can get the flu, you can get herpes, you can get mononucleosis. And so we have to help people understand that though things like social media, though your friends, though your social settings may be saying one thing, you need to know the facts. And when you have the facts, you can make a more informed choice or decision.
Absolutely. I 100%
And one other
agree.
thing is that
Yeah.
so when you sit in a hookah session, you actually take in about 75 liters of smoke in comparison to about 600 milliliters when you smoke an actual cigarette. So it's not better and it's not healthier
At all.
So
at all.
question, when you're like going to the like hookah lounges and they have like the food, even people that aren't necessarily smoking the hookah, are they still
Yeah.
being impacted?
Yeah, absolutely.
Absolutely.
Secondhand smoke exposure is significant. And African Americans, 19,000 die each year just from
Wow.
secondhand smoke exposure.
Exactly.
Just for being around people who utilize nicotine, you live around hookah and live with parents. And I know you have a
That's my
story, Dr. Chris.
You know, I don't have my dad anymore. My dad died during COVID. And one of the reasons COVID ravaged my father's body so quickly is because he had poor lungs. He had emphysema because he had been a lifelong smoker.
See.
And my dad grew up in Virginia. He said, I couldn't get a girl if I wasn't smoking. And he tried desperately to quit, but it was always something that he struggled with. And so I lived with a person who smoked. At one point, he was just smoking in the bathroom because we thought, okay, maybe that wouldn't be as dangerous. Then he was smoking in the car with the window down. Maybe that's not as dangerous. But I developed chronic bronchitis, and I still have chronic bronchitis.
So now you making me want to go get checked because I'm like, I grew up
Absolutely.
around that, and you don't know like some of the issues that you don't, like if you were around it even when they
Yes.
tried, it's
Yes.
like, no wonder why I keep getting these sinus infections
Yes.
or whatever the case might
And your
be.
skin, your hair,
Wow.
the things that people don't think about.
So do you feel like if people have been impacted by like being like, hey, I have a smoker in my house, I may be a secondhand smoker just by like being around them, do you feel like they can get tested for that? Or is there any type of test that people can run if they have been smokers and vaping and doing the hookahs?
Well, primarily, we tell people to go by how you feel, right?
Mhm.
So, for instance, as a person living with another smoker, some of your primary risks are going to be related to your lungs, right?
Wow.
So, are you having excessive cough?
Mhm.
Are you having recurrent cough? Do you do sometimes a lot of throat clearing? I used to do a lot of throat clearing even as a child, not understanding
And you
that
did
the
not
mucus
know.
was building up in
Wow.
response to the exposures that I was having. And then we want people to live in the frame of prevention. So talk to your provider, talk
Yes.
to your doctor about the risks and the habits that are in the family, not just the individual, so that your doctor can better equip you with information and then have a family conversation about how you get healthier as a family.
Yeah, absolutely.
And one other thing, shortness of breath as well. So we do CT lung screenings for people who have like a smoking history, but if you have a secondhand smoking history too, it may be appropriate for you to get a CT lung screening too.
All right, now when I come visit you in Atlanta, I'll be like, you know why I'm here. All right. So the next question is going to be, why has nicotine been used like and affected Black communities as bad as it has? Like,
Yeah.
do you feel like there is like,
I mean, there's science behind it for sure, but
Yeah.
particularly the tobacco industry in Philadelphia rolled out ice cream trucks to give out menthol cigarettes to our people. When they started mentholated products, they wanted to get Black people hooked at an alarming rate. And so what they did was they gave it out like candy to people across the country, and particularly they focused on urban centers such as Philadelphia, Chicago, Atlanta, and some other places in New York. Particularly, they gave this out, and then that through generations, people have taken menthols, and that's the number one product of choice for African Americans is menthols.
Yes, it's data says anywhere between 80 to 85% of Black people who smoke are smoking menthol cigarettes. And as Dr. Darty said, it was deliberate. It's an example of structural racism, right? Let's put toxins, let's put crap, let's put harmful things in communities where it's perceived that people have less power, right? Less access to information and healthcare. And then you begin to see the generational impacts of those predatory practices.
Yeah, I 100% agree. Go ahead.
And the menthol cigarettes, what it does, it makes it easier for you to smoke. So people inhale deeper, they inhale longer, and those receptors for nicotine enhance in the brain. So when you smoke these menthol cigarettes, you have longer exposure, you have more dopamine, so it feels better. So that same reward pathway just increases over time.
And it's harder to quit.
It is.
It's harder to quit.
So I'm going back to what you just mentioned about how like they put it in these underserved communities, because we can even think about that for like a food desert. Like for example, where I live in Atlanta, I'm like, why is there only like a Church's Chicken and a like they don't have access to those things, but now they're trying to like gentrify that area, right? But I 100% agree with that. Looking ahead, like what trends are you most concerned with when it comes to nicotine among younger generations, and what gives you hope that we can change that trajectory?
I think when we look at the trends and the data at Truth Initiative, we focus day in, day out on nicotine addiction. What we see is that the correlation of putting vapes with THC and CBD, and so the combination, so people don't feel like they're addicted to nicotine. They're like, oh, I just use this for marijuana use, but no, you use it for nicotine usage as well. And so people have that understanding of that you when you use blunts, particularly, you're using wrappers that have nicotine products in it, right? And so there's an element to it, just understanding. But I think one of our most concerns is particularly nicotine salts. And so we're gonna like dips and pouches that are coming back, like Zen. That people are using discreetly and being able to put it in the back of their mouth and kind of go through it. And we're seeing youth being able to do it and have nicotine usage throughout the day in their school day without being able to notify the teacher or being able to kind of have the telltale signs that they're using nicotine.
And the other thing that I would add to that, the trend that's alarming, I'm a public health physician. There's an all-out onslaught on public health. And we see evidence of that in tobacco control issues. You see departments at the CDC gutted, the Office on Smoking and Health. You see policies being changed coming out of the FDA and how we regulate these products. And so when we allow things like fruity flavors, menthol flavors, when we allow the introduction of new products like the pouches and the salts, it's a new way for the industry to try to like outmaneuver the science, but we got to keep our best wits and our best understanding about us.
And these products are not very well regulated at all. So you have no idea what you're inhaling.
And you know what's so crazy? I went to a gas station one time and they had a pop-up. And they were like, oh, this is a new way of smoking. Like, it doesn't have the effects. It doesn't have this. You can sign up. You can do. And I said, well, but it's still nicotine, right? You're just packaging it a different way, right?
It's interesting you say that because there's a lot of misconception around hookah, right? In a sense that people say, oh, no, it says on the label on the box, it says zero nicotine. But a lot of times it's mislabeled.
It's mislabeled.
Because it's not being regulated.
Yeah, and there are other products in it, too, that can hurt your lungs and your heart.
Yeah, they're thinking about the nicotine, but it's the other things that make this thing work.
Exactly.
Yeah, right. So what do you feel like Black parents, teachers, and mentors should be sharing with young people about hookah and vaping? And how do we have these conversations in a real way without pushing them away?
Yeah. So I'll tell the story really quickly. My dad, who struggled with smoking, it was so a part of his life growing up. He told my brother's 10 years older than me, if I could give you one piece of advice that I want you to follow, don't ever start. He says, because once I started, I've never been able to quit. And I saw my dad struggle through hypnosis, through every type of treatment, to the point where his lungs were destroyed. So I want parents, I want educators, I want our Black youth, I want our Black community to understand you only get one body on this earth. And with all of the forces and the factors that are deliberately out to harm our communities, we have to wield our power with more wisdom and with more truth.
Yeah.
And overcoming the misconception that it's healthy or that it's an alternative way of smoking that won't harm you, because it will.
Yeah. Well, wellness is such a major conversation right now, especially on social media. How can we redefine what community, celebration, and self care looks like without nicotine being the center of those experiences?
Yeah, so I can already say that it's going to take all of us standing up in our social environments. That means no hookah at the baby shower. That means no hookah at the party. It takes somebody in the
That's
group
it.
to be
Yeah.
able to lead and
That's
have the
it.
conversation like, hey,
Yeah.
we're not going to do that, and being able to stand up in your own social circles, because that's how we affect change. But also not letting these cultural moments like baby showers and graduations and moments that we want to celebrate
Showers,
to be
bachelor
overshadowed.
parties.
Right, all the things.
Look, I've seen it everywhere in Atlanta.
Everywhere.
Everywhere.
Gas
Everywhere.
stations, nail salons.
They have mobile hookah people
Yes.
who will come to your events and set up a hookah space.
I've been to them.
Yes.
They'll be in the
No.
corner. I'm like, wait, what are you here for? 'Cause
Exactly.
this-
Mobile
yeah.
hookah. No.
So I think just like when you talk about like Black Pride and understanding what that looks like,
Yes.
it's saying that the number one preventable cause of death in this
Number one.
country
Mm.
is nicotine addiction. It doesn't say it on your death certificate. It looks like in the day-to-day you live, and so you have to stand up in your own social circles to be able to really affect change.
And the number one killer of all people, all races, all genders is heart disease. And the number one modifiable risk factor is smoking.
And not only is smoking causing heart disease, but we know it also causes cancer, it influences stroke, it influences other respiratory
Wow.
issues, it influences your skin, it stays in your hair for up to 90 days. But the flip side of that is when you are able to quit, the body begins to heal itself. So the
Yeah.
sooner that we can educate people and we can move to healthier, more empowering behaviors, the better that our communities can live lives that are full and healthy.
And I would go ahead. Go ahead.
I was
Dr.
saying it's very quickly too. Once you stop smoking, your mucillary becomes very more active. So smoking, even if it's just for 5 days, 10 days,
Yeah.
that immediate effect is very profound.
If I can make a plug for things that we have at Truth Initiative as a tool and resource. So we have a great program called the X program. X program has helped 1 million people quit nicotine addiction. And so we have a great partnership that we're launching with NAACP, and we're so called the Breath of Freedom Movement. We're excited launching that at convention at
Yes,
NAACP.
yes.
And so we're excited for that, but particularly it's a great program that helps communities be able to encourage people, and people can join by text Pride and Progress. You can text that to 88709, or you can join Live Free. You can text that to 88709
Okay,
to
so wait,
join
what's
that.
the word again?
Yep, so join Freedom. Join Freedom to 88709. Join Freedom to
88709. We got to text it,
I
friends.
didn't
Pull out your
remember
phone.
It's okay. And I
Yeah.
just
Mike
put
Jones.
one other thing out there. And we still have quit lines, right? We do see
Yeah.
some cuts, but we still have quit lines. So if you're looking for, other resources in addition to the Breath of Freedom movement, 1-800-QUIT-NOW. You can call, you can talk to someone, talk to your physician, talk to your healthcare provider. And just know that the power really does rest in you, though there are powers that be that seek to destroy that.
Okay, wonderful. Well, we're going to wrap up with one last question for the audience. If everyone in this room could leave with just one action item or mindset shift after today's conversation, what would you want it to be?
I always say this, it is not related, but it is vote. Because what we see in public health, we see a lessening of the regulations to protect especially our most harmful from these products. We see the relaxing of policies that allow these products to flood our markets. And that means we got to vote at every level. So doctor's orders, vote, get your whole family to vote, get your whole block, your whole neighborhood.
Yeah.
Yes. 80% of heart disease is preventable. So the things that you do and the things that you don't do directly affects your heart. And it doesn't start when you're 50 or 60. When you're 20 and 30, those are the things that you're going to have to deal with when you're 60. So start now. You're never too young to care about your heart. Prevention is the key.
I would say that encourage your family and friends through the actions of love. If we want our families to be here, we want longevity in our communities. That means taking a stance, speaking up, not turning the blind eye to friends that we know are using nicotine at alarming rates. we know that all of our friends and we know our social circles, and it just means standing up. And if you truly love them, you'll say something.
I love that. Thank you guys so much for joining
you,
us
Jasmine.
today.
Thank
It was
you,
a great
Jasmine.
conversation.
Thank you.
And like you said, say it one more time for them. Pull out the phones and text.
Join Freedom to 88709, and it's
Absolutely.
a great 60-day intervention program that you can pass on to family and friends to help them quit in their journey.
All right. Well, thank you guys so much.
Thank you.
Thank
Yes.
you.
Thank you all for being here.
Yeah, thank you.